Bismillah ar-Rahman ar-Rahim. This presentation is directed by Ahmed Khalid Abu Nahla for Dr. Ahmed Thabit. My university number is 20 22 15 94 and my case number is 29. First, we are going to take a general look about the case and we are going also to take a general look about the aspirate and about the sediments before we answer the seven questions here below. The case is telling us that a 7-year-old male German Shepherd dog, the dog is currently resident in Istria but originated in Greece, with mildly enlarged mandibular lymph nodes are noted. So first we are going to look at the hematology. We are going to notice that red blood corpuscles count, hemoglobin, hematocrit, and reticulocytes, all of them they are lower than normal. And about the white blood cells count, neutrophils, and monocytes, they are all of them higher than normal. And then if we look at lymph node aspirate, we are going to notice some small round to oval bodies with distinct nucleus. And here are some root-shaped kinetoplasts here. And if we go to the unstained urine sediment, we are going to notice some of like a huge number of small round to oval crystals with brownish to green color. All of these note we are going to use them and to take them as a findings for the questions to answer the questions below. Here is the case summary and the givings. 7 years old male German Shepherd dog, originated in Greece and now in Austria, mildly enlarged mandibular lymph nodes. About the first question is, what organisms are apparent in the lymph node aspirate smear? First, we said about it, there are small round to oval bodies and there are others rod-shaped netoplast. So, mostly these bodies they are amastigotes of Leishmania infantum. And these bodies they are diagnostic features of intracellular protozoon. The aspirate is highly cellular with macrophages filled with these organisms, which indicates high parasite burden, and this is typical to active canine leishmaniosis. The second question is, what's your interpretation of hematological findings? Before we answer the question, if we go to the hematological findings, you are going to note that the red blood corpuscles and the hemoglobin and the hematocrit and the reticulocyte, they are lower than normal. And about the white blood cells count, neutrophils, monocyte, they are higher than normal. So we are going to answer this question in two parts. There is mild non-regressive anemia. This is according to the low hematocrit, low hemoglobin, and low red blood corpuscles count. And also, there is leukocytosis, white blood cells elevated, particularly in neutrophils and monocyte. And all of this, they are features and the changes that reflect chronic inflammatory response, likely due to the intracellular infection by Leishmania. Anemia is a common feature in canine leishmaniosis. Question number 3. What other biochemistry analyte would be good to look at in this case? Globulin concentration is so important to be assessed. In the dogs of leishmaniosis, so hyperglobamina is frequently observed in the chronic antigenic. But here in our case, if we look at the total protein, it's going to be elevated to 77.4. But it was not separated to albumin and globulin. The albumin-globulin ratio is often markedly decreased in the affected dogs, which can provide a useful diagnostic and monitoring information. But here in our case, it's not separated to albumin and globulin. Question number 4. How would you describe the crystals present in the urine sediment? if we go to the urine sediments and look at the crystals here, they appear in high number, and also they are round to oval in shape, and about its color, it's a brownish to green color. And all of this feature for these crystals, they are returned to the xanthan crystals, particularly in dog being treated to allopurinol, and this is a standard therapy for leishmaniasis. These crystals are not commonly found in the untreated dogs and often indicated with metabolic alternation due to the therapy. So these crystals are xanthan crystals. This is a result of the allopurinol therapy, and this therapy is used for the dogs with leishmaniasis disease. Question number 5 is, what are the most important differentials? The top differentials include four things. They are canine leishmaniasis, chronic kidney disease, allopurinol included crystals, and urinary tract infection. First, about canine leishmaniasis. This is confirmed by a test that called IF80 titer, which is stand for indirect fluorescent antibody test, and demonstration of amastigotes in macrophages that we can see here in the lymph node aspirate. Number 2, chronic kidney disease. This is suggested by proteinuria, hematuria, and the presence of urinary crystals. But if we go and look at the urea and creatinine here, they are still in normal ratios. Number 3, it's about allopurinol included crystals. As we said before, it is a result or it's a secondary to leishmaniasis treatment because this dog is treated by allopurinol. Number 4 is urinary tract infection. It's less likely as there is no leukocyte or bacteria that's seen into the urine sediments here. Differentials are interrelated as leishmaniasis can lead to renal pathology and it's normal and necessitates allopurinol use, which in turn cause, as we said before, xanthan crystalluria. Question number 6 is, which medication can cause these crystals? The medication is responsible for these crystals, as we said before, it is allopurinol, and this is used to manage leishmaniasis disease. And we are going to explain the mechanism of the formation for these crystals in the next question, question number 7. Question number 7 is, what is the mechanism of formation of these crystals? The mechanism of formation of these crystals is inhibition of xanthine oxidase enzyme by allopurinol, which is the medication we use to manage leishmaniasis. This leads to accumulation of xanthine, which is poorly soluble in urine, especially in acidic or in neutral pH. And we here has neutral pH, which is 7. Over time, excess xanthine forms crystals that can cause crystalluria. This is as well documented adverse effect of long-term allopurinol therapy in dogs treated leishmaniasis. This means as more time we use allopurinol to manage leishmaniasis, it will be well documented adverse effect of long-term allopurinol therapy in these dogs. Thank you so much. My name is Ahmed Khalid Abu Nahla.